Hi, my name is Dr. Raman Baveja. I'm a professor of psychiatry and public health sciences at Penn State College of Medicine. Again, the pandemic, as I mentioned, now the child is at home with the parents, and that parents are also juggling with their work and everything. And like all of the pediatrician, and we all know that the how important interaction of the kids with the other kids, like the social development phase, like learning and the social development phase, they both go hand by hand there. So yes, so now actually the suddenly, like, they were at home, and now in sometime in July August, when school would start reopening in 2021, and everyone is going back to school, so there was the struggle for the learning behind, and then now they're coming back to school. So I think that was the driving force of that, and we see them, like when you have like school open, the suddenly, like, ADHD diagnoses go up because of this thing. I think even that the behavioral health services, like the therapy, counseling, parent trainings, are the first line treatment, but accessing those services, unfortunately, is the challenge. Like, all depending upon, even in the like the area of practice, we have a lot of resources. But again, just can imagine, like, our pediatricians serving, our primary care are serving across the nation, and many family travel for 40 minutes, and getting the services can be the really challenging. So that could be the driving the force, like, just to, they were not have access to the therapy services, so that may be pulling towards, okay, we need to some alternative treatment, which is not the ideal, but sometimes that's the only option they have it there. So, that's, we were expecting, like, the telepsychiatry was on board, and everyone said, hey, now you don't need to travel, but you can be, like, you can have access to care. Even in the first phase of that pandemic, we were like, all the services were closed. The only option we have the telehealth services. But we noticed that when, just having that tele access from the healthcare system wise is not going to resolve everything. There are many other factors, like, the like the stories are there. They, like, in the rural community, they still use the flip phone, right? They don't have even the smartphone there, or the internet connectivity. Like, how many times we drive to some, like, rural area, and our network just disappear from our phone. So, and then, like, how the parents, like, how much they are technologically, like, advanced, they can just say where to click. And beyond that, like, many of the families, they have, like, what the stigma related to the mental health, what's related to that, or the mistrust in the system, like, racial and ethnic minority group, they just sometime, with the historically, they have the struggle with that one, coming from the different. So again, so we need to make sure that everyone, the system, from our healthcare wise, our practice wise, our policy wise, to make sure that every child has access to timely evidence-based care they needed there. So I think that's the whole, really I want to take home point is there. Mental health is struggling of our youth, actually, and this is the just we are showing, this is nothing changed. We are actually in the worst where we were, actually. And I think American Academy of Pediatrics, now they have the guidelines how you should be continue to monitor their, like, progress of their mental health, the suicide, as well as like early autism screening there. So we need to be very follow up there. But the other thing is that, like, we struggle sometime, like, yes, we identify, for example, the ADHD, and this child need that the parent management training, for example, or, like, even in the depression or anxiety, the first line treatment for the young kids, actually, you go for the therapy. But again, sometimes that's is not available very easily, so that can lead to the more, so I think the pediatrician wise, I think I was looking into that, there are the 54, like, SAMHSA funding program is there. It's called the telephonic access program. In the Pennsylvania, we call it the TIPS, telephonic access program. The primary care can reach out to child psychiatrist on call Monday to Friday, for example, in our state. And 46 plus state, and I think DC, they have those kind of the program. So they have, in addition to the access to the child psychiatrist, you can have access to the care coordination. I think they can have list of the resources in the community, like who is the like therapy can have it, or they can do the collaboration with the, like, for the one-time consult with the psychiatrist to just get the idea clarification. And I think we need to ask for every patient who walk into this one. I think traditionally, oh, the kids don't struggle with the mental health. That is not true. And we know it. We all know that. I think we are identifying more like, the mental health is as important as the physical health is. I think the early screening, reach out to the like therapist if you have in the community, that is a perfect, but which is not practical. We all agree upon that one. In those conditions, I think reaching out to this access program where you can have the care coordinator services can help this family to find the services which they need, evidence-based services.